Have you ever wondered if your child is getting good quality sleep? Well, let me ask you, have you ever caught them snoring, grinding their teeth, or waking up tired after a full night of sleep? These things might all seem normal or harmless or even cute, but they're actually signs of a condition called sleep disordered breathing. Now in kids, this term is called pediatric sleep disordered breathing, but it basically means that a child's airway is constricted or partially blocked, and it's making them hard to breathe while they're sleeping. Now this can be a serious issue, and a lot of you might think that this is probably a rare condition and there's no reason to worry that your child has it. Well, I can tell you that it's not as rare as you might think. Some studies estimate that more than a quarter of children have sleep disordered breathing, and about 5% of them have a severe form like sleep apnea. Now the good news is that if you catch this early on, there's a lot of things you can do to help stop this and prevent this from continuing and getting worse. But the problem is if you don't catch this and don't do anything about it, as that child is developing, they can have a lot of developmental issues, which we're going to talk about in a bit. But also this sleep disorder can get worse. One thing to note is when people get older and they end up developing sleep apnea or very severe sleep conditions, you don't just develop that overnight. You don't just wake up one day and say, oh, I'm going to have sleep apnea. That is a chronic condition that continually gets worse as it progresses. So first, I want to go over some signs that a child could have sleep disordered breathing. The first sign is mouth breathing. So mouth breathing is just like as it sounds, when you're sleeping or when you're even during the day, breathing with your mouth open. This is a serious problem because when kids are growing up as mouth breathers, as their jaw is developing, their mouth is always open. And what happens is their face will tend to grow in that elongated, narrow direction. Ideally, you should be breathing with your nose. Yes, both in and out of your nose. And your mouth should be closed. Your lips should be closed. Your tongue should be touching the roof of your mouth, not just the tip of your tongue, but also the middle and back part of your tongue. And your teeth should be slightly touching. This should kind of feel like a bit of a suction with your tongue touching the roof of your mouth. When someone grows up with their mouth posture like this, then their jaw will develop a lot better. Their jaw will grow forward and more wide. And what you'll find is their teeth will come in the right direction. They won't have as much crooked teeth, and even their wisdom teeth could be coming in the right position. Not only is this going to save a lot of money to prevent you from getting braces or going to an orthodontist, but also this is going to prevent a lot of airway issues. Because the other problem with the mouth staying narrow and the jaw growing more elongated is that the airway does not develop. Instead of that jaw being pushed forward and leaving that airway open, that jaw is instead pushed back and blocking that airway, basically making it harder for you to breathe. The other problem with mouth breathing is as you're sleeping and lying on your back, you're more likely for your tongue to fall back and cut off your breathing. This is a common cause for sleep apnea, especially in adults. As you're lying on your back, instead of that proper tongue posture where your tongue is actually touching that roof of your mouth, your tongue is instead falling back and cutting off your breathing. This can lead to snoring if it's partially blocking your airway, but it can also completely block off your breathing and lead to sleep apnea, where you're basically choking. Now this brings us to number 2, which is bedwetting. There is a huge link between wetting the bed at night, especially with kids, and having a sleep disorder. Now part of this could be because of some hormonal imbalances. Because during sleep, your body produces more ADH, or antidiuretic hormone. This is a hormone that basically prevents your kidneys from producing as much urine and will prevent you from having to pee. But if you have fragmented sleep or you're just not sleeping well, then it's going to throw off some of your sleep cycles, and it can also throw off your hormones so that you're actually producing less of this ADH. As a result, your kidneys can produce more urine and basically making your bladder fill up with urine and making it easier for you to wet the bed or wake up to have to go pee. Other reason that bedwetting is more likely is kind of what I talked about before, how that tongue can fall back and cut off that breathing. And this is more likely if a child is a mouth breather. Because when your body senses that you're choking in the middle of the night and you need oxygen, the first thing that goes is your bladder. And for a kid, this is what can cause them to wet the bed. Now, for an adult, this can be a similar process as well, but for adults, they don't typically wet the bed. This is what can cause them to wake up in the middle of the night and have to go to the bathroom to go pee. You might think it's just because you've been drinking too much water, or if you're drinking it right before bed. That could play a part too. but it could also be an indicator for a breathing obstruction. The third sign I want to talk about is snoring. We kind of talked about this already, but I really want to stress this point because a lot of people think that snoring is just a normal part of life. Snoring is a clear indicator that there is a breathing obstruction. Now, snoring can happen both in people that are mouth breathers and in nose breathers. In mouth breathers, we kind of already talked about if your tongue falls back and basically cuts off your breathing, it'll cause that soft palate or the roof of your mouth, like the back part of the roof of your mouth, to start vibrating, and that's what creates that snoring sound. It could also be because of really large tonsils or adenoids, which are these lymph tissues in the back of the mouth, actually towards the back of your throat area. But either way, you just have to know that snoring is a huge red flag and a sign of a breathing disorder. Now, the fourth sign is teeth grinding, or in other words, bruxism. Now, a lot of times what I tell my patients is if their kid is grinding their teeth while they're sleeping and also snoring, and this is like a regular habit for them, then they absolutely need to go to an ENT or an ear, nose, and throat doctor because they most likely have a sleeping disorder. Teeth grinding while we're sleeping is a natural response to kind of protect the airway. So if we're struggling while we're sleeping, the grinding back and forth is a mechanism that our body does to kind of shift the jaw forward in the hopes of creating more space for our breathing. Now, this teeth grinding has also been linked to some arousals while we're sleeping. So in other words, what that means is as we're sleeping, if our breathing gets cut off or essentially like we're choking while we're sleeping, our body will force ourselves to be awake. And this is what's called an arousal. And as we wake up, our heart rate goes up, our mind gets active, and then a natural response, again, is to grind our teeth back and forth. Whatever the case is, we know it is linked to bad sleep. And this is true for both adults and kids, but it is especially true for kids when they're sleeping. Now, the fifth sign is if your kid has really droopy eyes or a really tired appearance. Now, this might seem obvious, but I see this all the time and I feel like I need to talk about it, where kids are really droopy-eyed and they're just tired all the time, and people just think it's normal, that they just want to take a nap or something like that. But if that kid is seemingly sleeping all night long and you feel like they should not be tired all day, but they have these droopy eyes plus some of the other symptoms I talk about, then you should definitely be concerned. The sixth sign is poor mental functioning. Now, going based off what I said before, if someone is tired, they're not gonna function that well mentally. And we know that kids who are mouth breathers and kids who have sleep disordered breathing do not function as well in school. And they show a lot of the same symptoms as someone who has ADHD. In fact, the symptoms of ADHD and the symptoms of simply being tired are practically the same. What are the symptoms? Being tired, being irritable, being moody. You're also more likely to have learning disorders and struggle in school. The problem is sleep disordered breathing is very often misdiagnosed as ADHD. And in these cases, the ADHD medications don't do anything. In fact, they can make the sleep disorder worse. Now, am I saying that ADHD is a fake disease? No. But I am saying that sleep disordered breathing is a real problem that is often misunderstood and misdiagnosed in kids. So if you're concerned that your kid has ADHD and you're thinking about putting them under a medication, you should definitely look into their sleep a little bit, because the criteria for diagnosing ADHD right now does not do anything in terms of evaluating sleep. And you might say, well, my doctor did ask how my kid is sleeping, but that's not a real assessment. To get a real assessment, you need to get their airway evaluated, check their tonsils and adenoids, possibly get a sleep study, and really have a sleep-trained doctor to look over these things. Now, speaking of your tonsils and adenoids, the seventh thing I want to talk about is frequent tonsil and adenoid infections. Now, this a lot of times is related to mouth breathing. Actually, there's evidence that mouth breathing can directly cause tonsil and adenoid infections. Now, there's a few reasons for this. The first is nose breathing actively prevents tonsil and adenoid infections. So I want to start with that. So when you breathe in and out through your nose, first you produce a molecule called nitric oxide. Nitric oxide is both a vasodilator and also an antibacterial. So when you're breathing in and out through your nose and you're producing this nitric oxide molecule in this nasopharynx area, which is where your tonsil and your adenoids are, this is going to really help keep that whole area clean. So any bacteria that get in this area are going to be way less likely to cause problems because of this nitric oxide. Also, your nose is a great filter. It'll filter out a lot of dust and particles, and also it'll filter out about 98 to 99% of viruses and bacteria. You want to know how much bacteria your mouth filters before it goes to your throat? 0. Your mouth does not filter anything. And also, you don't get any nitric oxide. And on top of that, when you breathe in and out of your mouth, you're gonna be drying your tissues. You're drying up all the saliva in your mouth and your throat area. And your saliva also has a lot of antibacterial components to help keep everything clean. And the last reason I want to talk about, there are some more, but when you breathe in and out of your nose, you tend to engage your diaphragm more. Now, why is this important? How does this play into your tonsils and your adenoids? But your tonsil and adenoids are lymph tissues. And your diaphragm is one of the best muscles we have to drain lymph in your body. If your lymph tissues are not drained, then they can swell up. And this would suck if it happens to your tonsils and your adenoids because it can make it really hard to breathe. But this is exactly what happens with mouth breathers because mouth breathers tend to take really shallow breaths and only engage the upper half of their chest. They don't really engage their diaphragm. And this can cause those lymph tissues to not get drained and to swell up and more likely to get infected. Instead, if you were breathing through your nose, getting all the other benefits I talked about, but also engaging your diaphragm, you're also going to be more likely to drain the lymph in your body and drain those tonsils and adenoids. So all these things play into a part of simply keeping those tonsils and adenoids not super large, but smaller so that they do not obstruct your breathing. Now, if you're watching this and you're concerned about your kid because they might have this sleep disorder breathing, what can you do? Well, the first thing I would do is just observe their sleeping patterns. Watch out for any snoring or any restlessness or really weird sleeping positions like tilting their head back. Because when you tilt your head back, that's a natural mechanism to improve your airflow. Think about when we're doing CPR. When we're doing those rescue breaths, we're taught to tilt that chin up so we can open up that airway. That's a natural thing we do when we're struggling breathing at night. If you do notice these signs and some of the other signs I already talked about, then you can consult with a professional. You can consult with a sleep-trained dentist. You can also try talking to pediatric dentists or an ENT or ear, nose, and throat doctor because they're gonna be able to check the whole airway and check for the tonsils and adenoids, the tongue position, also the nose, see if the nose is deviated at all. So these are some of the best people to go to. Now, there are some other areas of expertise that you could explore. One of them is myofunctional therapy, where you basically strengthen the tongue and the lip muscles, and a lot of the exercises that they give can improve that oral posture so you don't get that, for example, tongue falling back and cutting off your breathing. You can also explore something called orthotropics or forwardontics. Now, these are fields you probably have not heard of before. Now, I'm gonna be honest, they are very rare and they can be expensive, and it's better to go as early as you can with your kid. But these are fields that kind of branched away from orthodontics, the standard like braces or Invisalign, and they cater more towards growing the jaw forward and growing the jaw wide using your natural muscles. The benefit with these fields is you're gonna make the biggest difference in the airway and their breathing and their livelihood, because going to a standard orthodontist, for example, all they're really gonna do is straighten the teeth and make them look good. Don't get me wrong, they're very important, but if your main goal is improving the breathing while sleeping, a forwardontist or an orthotropist is gonna be the way to go. And the other benefit with them is you're still gonna have straight teeth and you're still gonna have a nice looking smile, but you won't need any retainers after. A lot of times people go to an orthodontist and they hate the fact that they have to wear the retainer for the rest of their life, otherwise their teeth will shift. Well, the reason that you need that retainer is because you were not trained in that proper oral posture at all times. When you go to a forwardontist or orthotropist, they train you so you don't need that retainer, but your tongue and your jaw muscles will basically act as a natural retainer because you're gonna be having proper oral posture at all times. Now, with that being said, if it's really hard to find an orthotropist or a forwardontist and you really want to correct the crowding in your child's teeth, then by all means still go to an orthodontist. But I would strongly urge you to avoid getting any teeth pulled out. Sometimes orthodontists feel like there's not enough room to straighten the teeth, and they want to take out, for example, 4 of the premolars to make enough room to pull all the teeth in the right direction. The problem with this is the research shows that down the line, like 20 years down the line, the airway really does not develop enough because that jaw starts to get pulled back when you do this. When you keep the teeth and you try to widen the jaw, then the jaw will grow forward and really open up the airway and prevent things like sleep apnea. Now, there are some other videos I made on how to generally improve sleeping conditions, not really just focusing on breathing, but other things as well. So I'm putting a link in the description below if you want to check that out. And I also made other videos on the importance of nasal breathing. I know I talked a lot about it in this video, but I went into detail on it in some other videos. And I also talked about how you can transition your child from a mouth breather into a nose breather. So check out those links in the description below so you can definitely learn more about that. Anyway, thank you guys for watching. I hope you liked that video, and if you haven't already, make sure you hit that thumbs up button and subscribe to my channel below, and I'll see you in the next video. Do you think that sugar is the only food that can damage your teeth? Well, you might want to think again, because a lot of different foods, even foods that have no sugar, could be destroying your teeth. Let's talk about it. So your diet is the biggest contributor to cavities and gum disease, even more so than not brushing and flossing. So if you were to pick between